Good afternoon. My name is Sandie Lontouo, and this is my innovation project video proposal. This is from the University of Massachusetts Global, and the class is Dnpu 702. My instructor is Dr. Lisa Ringberg, and today is February 25th, 2024. So my innovation project is focused on solving the problem of hypertension. According to Armstrong, hypertension, which is the most prevalent chronic disease in the United States, is one of the most significant preventable contributors to disease and death in the United States. It leads to heart attack, cerebrovascular attacks, and kidney failures, and also it can lead to death if it's not well controlled or if it's not detected in a timely manner. In primary care settings, proper management of blood pressure will help reduce many other risk factors. Providers should be the primary contributor of having their patients to adhere to treatment regimen. Blood pressure reduction lifestyle treatments such as nutrition, exercise, and stress management are frequently integrated and have variable degrees of success. In addition to lifestyle changes, mobile health and other information and communication technology have made it easier for people to be able to manage their chronic condition. Patients with hypertension currently have access to a large number of smartphones, application with hypertension management and also to help them control their condition. This is from Almo. Now, the background of the problem. Let's talk a little bit about hypertension. Hypertension is one of the most significant preventable contributors to disease and death in the United States. Hypertension is one of the chronic diseases that can cause physical, psychological, social, and economic problems, thus affecting the independence of the individual and increasing their care needs. The optimal purpose of hypertension treatment is to ensure that blood pressure is controlled to its best in the patients being treated. Providing patients with self-management skills through various support programs will be beneficial and will help in managing hypertension. So the key to effective hypertensive therapy is to adhere to therapeutic recommendation and ensure appropriate cooperation with the entire medical team to medical recommendations, as well as being compliant during every aspect of the treatment in place. Who were my collaborators? So the participants in my innovation project were the patient. It was one patient with a known diagnosis of stress-related hypertension, the medical director of the company where I currently practice, and the staff of the company in general, but I did an emphasis on the medical assistant in particular. So I chose these three participants, called them collaborators, because they are directly related to the effective use and launching of the tension timer mobile application, which is introducing it to you to now. It is my innovation project proposal using tension timer which is a mobile application that will help in managing hypertension. We'll go in more detail in the next slides. The patient is chosen particularly because he's going to be the one using the app. So this particular patient was diagnosed with hypertension about 5 years ago. He's an investor, and he encountered a lot of work related stress. So he encountered a lot of stress at his workplace. He's currently on 2 blood pressure medication, but he reports having elevated blood pressure when he is facing a lot of stress. With his history of known stress-related hypertension, he was a good candidate to collaborate with. So I spoke to him about why I am collaborating with him. He verbally agreed to the collaboration. So, and then he also bring a very good insight to how to launch the application. So he said that he talked about a study that was conducted by Elnor and his group about an application that was designed to inform participants in the intervention group on hypertension, so including treatment, diet, therapy, complications, and other related topics. So he was saying that that application will send brief messages at random time during the day, and then to remind the patient to go to the application. It's time for you to go to the application to check your blood pressure, or to read about how to manage your blood pressure, giving you exercise to do during the day. So he was telling me that this is something that I should also consider while I am implementing this application. The medical director was chosen because she is the primary care clinic's decision maker. She is my boss, so if I have to do anything, how to introduce anything to the benefit of the patient, I have to go through her. She has to approve it. So my boss is also a nurse practitioner at Dnpu, and she does have experience with mobile applications. So she's aware of different mobile apps that are meant out there to help patients with some medical condition they are suffering from. So she has been a nurse practitioner for over 15 years, and then a medical director since 2014. In 2014, so she has knowledge of mobile health application and has used some of the mobile health application to promote health on some of her patients. So she routinely engages in evidence-based practice that include accessing scientific literatures. She discussed her knowledge of incorporating mobile technology into the office. So according to her, platform compatibility, keeping patients' data private, and the ability for the organization to perform well under an increase of expanding workload were critical factors to consider while launching my innovation project. She made a very good point that to make sure that that application will be HIPAA compliant, will make sure that it's not going to divulgate patients' data to the public, and that was her contribution to my project. And she was also interested to see what the grade I will have after the project. The last person was the medical assistant. The medical assistant was chosen because she will be the one helping the patients to download the app in their phones, and eventually it will help them how to properly use it. So my medical director has 10 years of experience. Medical assistant, my bad, 10 years of experience, and she's an expert in assisting patients with the installation of mobile apps for their smartphone. She also is an expert in explaining the app's purpose to patients and how to use it. So her insight was very important during this collaboration for me to introduce a tension timer application to help manage blood pressure. Now let's talk a little bit about the tension timer, What is it? What application? What does it do? Okay. My project, the project I've been working on, is involved in addressing the solution for hypertension management. So we're using the development of a smartphone delivered breathing awareness meditation application, also called BAM. So you will hear me say BAM here and there. It stands for breathing awareness meditation application. So the tension timer and the breathing awareness meditation application, they work together to help relieve stress by relieving stress on the patient. It also eventually lowers the patient's blood pressure. So Adams and all in 2018, they did an experiment that was an experimentally supported method of using stress centered iterative design strategy to utilize the tension timer smartphone app. Was informed by theories of technology utilizing and behavioral modification. The idea behind tension timer smartphone app is to combine photoplethysmograph features with breathing awareness meditation with BAM in order to lower blood pressure while measuring the heart rate and adherence and reduces stress. So tension timer uses a smartphone's video camera, an LED flashlight, to record real-time heart rate using proprietary software that uses reflective photoplethysmography. Through the capillary beds in the finger, the video camera and software can detect your heart rate, pulses, and output the digital reading on the interface and store the session's heart rate data. So in summary, while you are listening to the breathing awareness meditation, use your phone, the capillary bed of your phone, you put it on top of the camera lens, and then it will be measuring your heart rate while you are listening to the meditation. You're doing the breathing awareness meditation. This process usually takes to have a good effect. It can take up to 15 minutes, and then to see the complete effects, the literature says that Gigroski and his team, they did a research over 3 months, and then they found they started seeing results after 3 months of starting the project. So tension timer is patient centered, and it's designed breathing awareness mobile application, and is compatible with Android and also the iOS platform. Okay, so why do I think that my tension timer is an innovation? Innovation in general has many advantages, right? Innovation is a discipline. Innovation must be adequately supported by enough time and money, attention, and other resources to ensure its application fits for the organization. Tension timer is free. You can download it on Android and iOS, like I said before. So the tension timer is innovative because it is made to improve health condition of patients. The tension timer smartphone application effectively reduces stress and improves blood pressure with increased adherence, leading to improved ambulatory blood pressure over a 3-month period. And then this is my references. Thank you for listening to my video, and then you can email me any questions if you have. Thank you.